Hello, and welcome to your Microbiology Bio 203 video lecture on microbial diseases of the digestive system. I'm Mr. Kennedy, and I'll be your guide as we explore this topic together. To begin, we need to examine the basic architecture of the digestive system and its rudimentary functions. The gastrointestinal tract, or alimentary canal, is made up of your mouth, pharynx, esophagus, stomach, small and large intestines. It has a number of accessory structures such as your teeth, tongue, salivary glands, liver, gallbladder, and pancreas. When considered together, we refer to all of these structures as your digestive system. This is a rudimentary diagram illustrating all of the working parts of your digestive system. The basic function of the digestive system is fairly obvious and self-explanatory: to digest and absorb food. Upwards of 25 tons of food pass through the GI tract in the average person's lifetime. What's not so obvious is the immune function associated with the digestive system. About 80% of the immune system is located in the intestinal tract in structures referred to as gut-associated lymphoid tissue, which is made up of lymph nodes and Peyer's patches. The normal microbiota of the digestive system contains millions of microorganisms. There are millions of bacteria per mil of saliva, few microorganisms in the stomach due to hydrochloric acid production, while in the small intestine, Paneth cells, which are granule-filled phagocytic cells that produce defensins, limit microbial growth there. The majority of the microbial life found in your digestive system can be found in the large intestine. The large intestine supports the growth of anaerobes and facultative anaerobes. You can find upwards of 100 billion bacteria per gram of fecal matter. Diseases of the mouth. To explore diseases of the mouth, one must first examine the teeth and gums. This is a typical cross-sectional diagram of the average tooth for a human. Dental caries, or tooth decay, more commonly referred to as cavities, are formed as a result of dental plaque growing on teeth. Dental plaque is formed as biofilms grow on and around your teeth. There are 700 species of bacteria in the oral cavity. Streptococcus mutans is the most important karyogenic organism and responsible for the majority of dental caries experienced in humans. It is a gram-positive coccus which converts sucrose to lactic acid. Lactic acid can literally erode away the enamel of your teeth. It can also produce dextran, a polysaccharide that forms plaques. Plaques attract other karyogenic bacteria, streptococci, and filamentous actinomyces. Caries penetrate from enamel into the dentin, and they are caused by gram-positive rods and filamentous bacteria growing at or very near the gum line along the tooth, or in the nooks and crannies of the top part or the chewing surfaces of the teeth. Decay can reach the pulp, which contains the blood supply and nerve cells, and may advance to soft tissues, leading to abscesses. Introduction of table sugar into the diet is directly correlated with the level of dental caries that we see in people today. This is an illustration of the advancement of tooth decay. Periodontal disease. Gingivitis is inflammation and infection of the gums. It's caused by streptococci, actinomyces, and anaerobic gram-negative bacteria. Periodontitis is bone and tissue supporting the teeth being destroyed. Acute necrotizing ulcerative gingivitis, or trench mouth, is also a form of periodontal disease caused by Prevotella intermedia. This is an example of periodontal disease. Bacterial diseases of the lower digestive system next. Staphylococcal food poisoning is an excellent example of a bacterial disease of the lower GI tract. Staphylococcus aureus produces an enterotoxin, serological type A, which can coagulate blood plasma. The toxin is not killed by boiling. The toxins are produced when the organism is allowed to incubate in food through temperature abuse, which simply put means that foods that are supposed to be kept cold are allowed to sit at warm temperatures, or foods that are supposed to be kept hot are allowed to cool to warm temperatures, temperatures supporting microbial growth. Staphylococcus aureus outgrows most bacteria in high osmotic pressure and high temperature. Phage typing traces sources of contamination. This flowchart is meant to illustrate the sequence of events in a typical outbreak of staphylococcal food poisoning. Shingillosis. Shingillosis is caused by the genus Shingella, a facultative anaerobe gram-negative organism, of which there are 4 species. It produces the shingitoxin. It has a very small infectious dose and attaches to M cells, invades and spreads to other cells, can damage the intestinal wall, and can invade the bloodstream. It's treated with chloroquinols and oral rehydration. This is an illustration of shingillosis. Salmonella. Salmonella enterica is a gram-negative, facultative, anaerobe, non-endospore-forming rod. It is a normal inhabitant of the human intestinal tract. There are 2,000 serotypes. It invades intestinal mucosa and multiplies, passing through M cells and enters the lymphatics where it can replicate in macrophage. Has an incubation time of 12 to 36 hours and can cause fever, nausea, pain, cramps, and diarrhea. This is an illustration of salmonellosis. Salmonella causes 1.4 million cases of food poisoning annually and 400 deaths. It's associated with commercial chicken and egg production. The bacteria can survive in raw eggs in the albumin. It can be diagnosed directly from the stool or by PCR and treated with oral rehydration therapy. Typhoid fever. Typhoid fever is caused by Salmonella typhi and is spread only by human feces. It's rare in the United States today due to sanitation. Most typhoid outbreaks are associated with breakdowns in sanitation. Bacteria are spread throughout the body in phagocytes. It releases the organism into the bloodstream. It causes a high fever, headache, intestinal wall ulcerization, and 1 to 3% of patients will become chronic carriers and harbor the organism in their gallbladder. It can be treated with chloramphenicol, quinols, or cephalosporins. Cholera. Cholera is caused by Vibrio cholerae, which is a slightly curved gram-negative rod with a single polar flagellum. It's associated with salty waters and produces the cholera toxin. The toxin causes the host cells to secrete electrolytes and water and causes rice water stools. You can lose 12 to 20 liters of fluid per day through rice water stools, which can lead to shock, collapse, organ failure, and death. Treatment includes IV fluid replacement. Non-cholera vibrios mostly are adapted to salty coastal waters and include Vibrio parahemolyticus, which is found in saltwater estuaries and common cause of gastroenteritis. Eating raw oysters and crustaceans are associated with outbreaks. It requires early antibiotic therapy for a cure or treatment. E. coli. E. coli gastroenteritis is caused by enteropathic E. coli, or EPEC, which can lead to diarrhea in developing countries and cause the host cells to form pedestals where the bacteria attach. Enteroinvasive E. coli causes shingle-like dysentery. Enteroaggravated E. coli is found only in humans and produce an endotoxin causing watery diarrhea. E. coli gastroenteritis continued with enterohemorrhagic E. coli, which produces a shingle-like toxin and release upon the cell's lysis. Most outbreaks of enterohemorrhagic E. coli are due to serotype O157H7, and cattle are the main reservoir for this serotype of E. coli. It causes hemorrhagic colitis and hemolytic uremic syndrome, and it's diagnosed by the inability to ferment sorbitol and pulse field gel electrophoresis. Traveler's diarrhea is the most common of ETEC, and the second most is EAEC. It can also be caused by Salmonella, Shingella, and Campylobacter. Oral hydration therapy and bismuth-containing preparations are the best treatments for traveler's diarrhea. Campylobacter gastroenteritis is caused by Campylobacter jejuni. This is a gram-negative, microaerophilic, spirally curved organism, the leading cause of foodborne illness in the United States. It's common in intestines of poultry. 60% of cattle excrete this organism in feces and milk. It can cause fever, cramping, abdominal pain, diarrhea, and dysentery. 1 in 1,000 cases leads to Guillain-Barré syndrome. Next, we'll look at Helicobacter. Helicobacter cause peptic ulcer disease. The organism responsible is Helicobacter pylori. It infects 30 to 50% of the population in the developed world, grows in the stomach acid by producing urease, and converts urea to alkaline ammonia. This disrupts the stomach mucosa, causing inflammation. It can be treated with antimicrobial drugs and bismuth. The diagnostic test requires a biopsy, culture, and urea breath test. Yersinia gastroenteritis. Yersinia gastroenteritis is caused by Yersinia enterocolitica and Yersinia pseudotuberculosis. It's a gram-negative organism that inhabits animals, is transmitted in meat and milk, and grows at 4 degrees Celsius. It causes diarrhea, fever, headache, abdominal pain, and is often misdiagnosed as appendicitis. Treatment with antibiotics and oral rehydration is common. Clostridium perfringens gastroenteritis is a gram-positive endospore-forming obligate anaerobic rot. It also causes gas gangrene. Clostridium perfringens is associated with foods containing animal intestinal contents and creates low oxygen levels. This organism produces an endotoxin, and symptoms are usually mild and occur 8 to 12 hours after ingestion. Clostridium difficile associated diarrhea is an organism that is gram-positive, endospore-forming anaerobe. Clostridium difficile causes more deaths than all other intestinal infections combined, mostly in a healthcare setting. It causes life-threatening colitis, ulceration, and perforation of the intestinal wall. It's precipitated by the extended use of antibiotics, which eliminates competing intestinal bacteria. Bacillus cereus gastroenteritis. Bacillus cereus is a large, gram-positive, endospore-forming organism common in soil and vegetation. Bacillus spores can survive heating and germinate and produce toxins. Different toxins cause different symptoms. Viral diseases of the digestive system. Mumps. Mumps is caused by a virus that targets the parotid glands. This virus causes painful swelling 6 to 18 days after exposure and is transmitted in the saliva and respiratory secretions from person to person. It will multiply in the respiratory tract and reach the salivary glands via the bloodstream. It may cause orchitis, swelling of the testes, meningitis, ovary inflammation, and pancreatitis. It can be prevented with the MMR vaccine. Hepatitis is inflammation of the liver. May result from drug or chemical toxicity, Epstein-Barr, cytomegalovirus, or the hepatitis virus. Hepatitis A, or HAV, is a single-stranded RNA virus which lacks an envelope. It typically enters the body via the oral route, multiplies in the epithelial lining of the intestinal tract, and spreads to the liver, kidneys, and spleen. It can cause anorexia, malaise, nausea, diarrhea, fever, and chills, later jaundice and dark urine. Symptoms can last 2 to 21 days, but it has a very low mortality. It's detected via IgM and anti-HAV. Treatments with immunoglobulin are most common. Hepatitis B. Hepatitis B is a double-stranded DNA enveloped virus which resembles retroviruses. It's transmitted via the blood and body fluids. Up to 1 billion viruses can be found per ml of blood. It has spherical particles and filamentous particles which lack DNA. They do contain hepatitis B surface antigens. Hepatitis B can be prevented by a vaccine and treated with hepatitis B immunoglobulin, HBIG. Hepatitis B can cause both acute hepatitis B and chronic hepatitis B infections. The acute hepatitis B is often subclinical and similar in symptoms to hepatitis A, and patients will experience a gradual recovery. Fulminant hepatitis occurs in 1% of the cases where sudden, massive liver damage occurs, which is fatal. Chronic hepatitis B involves 10% of infected patients and may lead to liver cirrhosis or liver cancer. The presence of HBAG indicates a vigorously replicating virus. It's treated with interferons and nucleoside analogs. Hepatitis C is a single-stranded RNA enveloped virus, often transmitted. It destroys the liver by causing genetic variation to evade the immune system. It kills more in the United States than AIDS. 85% of cases become chronic, 25% develop liver cirrhosis or cancer. It is treated with PEG interferon and ribavirin. There is no vaccine. Other hepatitis viruses include hepatitis D and E. Hepatitis D can cause an acute co-infection and chronic superinfection. They are linked to hepatitis B infections. Hepatitis E is spread by fecal-oral transmission, similar to hepatitis A, and is endemic in areas with poor sanitation. Viral gastroenteritis may also include rotavirus and norovirus. Rotavirus is common in children, has a low mortality rate, 2 to 3 day incubation period, creating a low-grade fever, diarrhea, and vomiting. It's prevented with a live oral vaccine. Norovirus, or calicivirus, is also passed from fecal-oral transmission, takes a very low infectious dose, and an 18 to 48 hour incubation, leading to diarrhea and vomiting, is detected with PCR and EIA tests. Fungal diseases of the digestive system. Mycotoxins are toxins produced by fungi, and they can lead to blood diseases, nervous system disorders, kidney, liver damage, and cancer. Ergot and aflatoxin poisoning are two common fungal diseases of the digestive system. Mycotoxins produced by claviceps occur in grain, and when ingested can restrict blood flow and cause gangrene and hallucinations. Aflatoxin mycotoxins are produced by Aspergillus, are likely to be found on peanuts and cause liver cirrhosis and liver cancer. Protozoan diseases of the digestive system. Giardias is caused by Giardia intestinalis, which is a flagellated protozoan. This protist forms cysts in feces and water. The trophozoites in the body can attach to the intestinal wall. It will create prolonged diarrhea, malaise, weight loss, flatulence, and cramps. Hydrogen sulfide, detected in the breath or in stools, is a good indicator of Giardias. It can also be diagnosed with a string test, ELISA or FA test, and treated with metronidazole and nitrozole xanthanide. Cryptosporidosis. Cryptosporidosis is caused by Cryptosporidium parvum and Cryptosporidium hominis. Its ingested oocysts release sporocytes into the patient. These sporocytes will invade the intestinal epithelium, create cholera-like diarrhea for 10 to 14 days. It can be transmitted through drinking water, and it is resistant to chlorination. It can be diagnosed with an FA test or immunoassay test and treated with nitrozonamide. Cyclospora diarrheal infection is caused by Cyclospora species. This creates days or weeks of watery diarrhea. oocysts are ingested from drinking water contaminated with feces. There are no satisfactory diagnostic tests, and it's treated with trimethoprim or sulfa drugs. Amoebic dysentery is caused by Entamoeba histolytica, which produce cysts that survive the stomach acid. The trophozoites produced from the cysts in the intestines multiply in the wall of the large intestine. Feces will contain blood and mucus and can be perforated, causing abscesses. The organisms can also invade the liver. Detection with latex agglutination and FA tests is common, and it is treated with metronidazole plus idoquinol. Helminthic diseases of the digestive system. Helminthic diseases are worm diseases. Tapeworms are amongst the most common intestinal worms. 1 in 10 people worldwide have some sort of intestinal worm infection. The beef, pork, and fish tapeworms are the 3 common varieties of tapeworms experienced by people. Teniasis is what we refer, or a term we use to refer to an adult tapeworm that infects the intestine. Cystirosis is infection with the larval stage by ingesting eggs. Ophthalmic cystirosis is where the larva will lodge in the eye. Neurocystirosis is where the larva will develop in the central nervous system. There are 3 stages to the typical tapeworm life cycle. Eggs are excreted in the feces and ingested by animals. The eggs hatch into a larval cysticerus and that lodges in the muscle. The human ingests undercooked meat containing the cysticeri, which develop into adult tapeworms in the intestine. Diagnosis with eggs or segments of the organism in the feces is most common. It can be treated with paraquintal and albendazole. This is the life cycle of a tapeworm. Hydatid disease. This is caused by the tapeworm Echinococcus granulosus. The eggs are ingested and migrate to the liver, lungs, and brain and develop into hydatid cysts, which can grow and hold up to 15 liters of fluid. They may rupture and cause anaphylactic shock. Diagnosis is accomplished using serological tests, X-rays, CTs, and MRI. Treatment is accomplished with surgical removal and albendazole. Pinworms. Enterobus vermicularis cause pinworm infections. These are tiny nematode or roundworms who lay their eggs around the anus, causing local itching. Treatment with pyrantel, pamodate, and mebendazole is common. Hookworms. Hookworms or hookworm infections are caused by the nematode Necatar americanus and Ankylostoma duodenale. It attaches to the intestinal wall and feeds on blood and tissue. It can cause anemia, lethargy, and a craving for particular foods. It's carried from human feces in the soil that contact bare skin and is treated with mebendazole. Ascaris. Ascaris infections are caused by the nematode Ascaris lumbricoides. Ascaris infections account for 30% of the worldwide population of intestinal infections. The eggs are shed in feces and ingested by another person. They hatch into larvae, pass into the bloodstream and into the lungs. The larvae migrate to the throat and are swallowed. The larvae develop into adult worms in the intestinal tract and emerge from the anus, mouth, or nose. And the treatment is accomplished with mebendazole or albendazole. Whipworm. Whipworm is a worm that can be 30 to 50 millimeters in length. Its distribution is similar to A. lumbricoides. The eggs are ingested and enter the intestinal glands. They hatch out and grow into the intestinal surface. The adult worm buries into the intestinal mucosa and lives as a parasite, and it feeds on cell constituents in blood. It can cause anemia, malnutrition, and retard growth. Treatment, again, is with mebendazole and albendazole. Trichinelosis is caused by Trichinellus. This is our final disease of the microbial infections of the digestive system. Trichinellus has an encysted larva that can be ingested from undercooked pork and other meats. Digestion removes the cyst wall, and the worm matures into the adult. The adult-produced larva in the intestines that invade tissues and form new cysts. Trichinelosis can cause fever, eye swelling, gastrointestinal upset, and again is treated with albendazole and mebendazole. This is the life cycle, trichinelosis, or trichinella. This concludes our coverage of microbial diseases of the digestive system.